Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us a very senior orthopedic surgeon, Dr. Avinash Date. Dr. Avinash Date is with the Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute in Mumbai. And he is very experienced. He has over 30 years of experience. And he specializes in bone and joint orthopedics. He's an MS in orthopedics, DNB and MRCS from Edinburgh, FRCS, and a diploma in health administration that he's done. And we are really delighted to have him here. He has completed his post-graduation in orthopedics from the KEM Hospital and worked as a lecturer in the LTMG Hospital Science for 3 years. And then he gained experience in complex trauma in this period. He has worked at various multi-speciality hospitals in Mumbai as consultant and head of the department, was also teaching faculty for arthroscopic surgeries in the UK. He's did his fellowship in knee surgeries through the International Center for Orthopedic Education in France. He had a Asia Pacific fellowship in lower limb arthroscopy in Australia. He worked in the UK for 6 years and gained valuable experience in trauma and arthroplasty. He mastered new techniques in joint replacement, including computer navigation during this time. And he has done several total knee replacement, total hip replacement, and trauma cases, over a period of time. And we are really delighted to have somebody as senior as Dr. Date here to talk about osteoarthritis. Welcome to Health Live at Seniors Today, Dr. Avinash Date. How are you?
Right. It's just an informal talk about osteoarthritis and what the problems senior citizens face and what are the new advances in that. What are the solutions? I'll just talk about it.
Right. So, great. Thank you, Doctor. Over to you for your presentation.
Thank you.
And even as Doctor gets his presentation ready, remember the sessions like these are advisory in nature. In case you have any major problems, you should consult a doctor, get a clinical view done, and do remember that this session is being recorded. The recording will be available on the Seniors Today website from Monday evening, along with the takeaways. So over to you, Doctor.
Thank you. All right. So,
yeah, we can see the presentation.
Right. So it's about osteoarthritis. Osteoarthritis is essentially wearing of the articular cartilage. So we'll have a look at the different parts of knees. So these are the different parts of knee. So as you can see it in the picture, there is articular cartilage, a smooth. I'll just do the highlighting just a minute. As you can see, this is the articular cartilage here. And articular cartilage is a smooth covering over the bone, which actually protects the joint. There are ligaments around the knee joint. This is the medial and lateral side, and there are two ligaments inside the knee joint also. There are menisci, which are the cushions between the two bones, which function as a shock absorbers. And there is synovial fluid, which provides the lubrication. As you can see in this picture, that's the smooth articular cartilage. And in the picture here, you can see the articular cartilage is totally worn. This is arthroscopic view, keyhole view of the articular cartilage. That articular cartilage is totally worn. That is osteoarthritis. So there are two types, primary and secondary. Primary is age-related degeneration of the articular cartilage. Secondary can be secondary to either rheumatoid arthritis, which is Sandivat, AVA, or intra-articular fractures, ligament injuries. It could be because secondary to psoriatic arthritis, acute or chronic infections in the knee joint, or because of the tumors. What are the symptoms? The symptoms are mainly pain, difficulty in walking, especially downstairs walking is difficult. There are the certain cases where upwards walking also is difficult. So depending on different parts of the knee which are affected, the upwards or downward walking will be difficult. Then walking distance is reduced as a whole, and the night pain indicates very severe osteoarthritis. So what does it do to our life? It affects our social life. In what way? It avoids, you start avoiding social functions like marriages because of the knee pain, anniversaries, birthday celebrations. It has negative effect on the social life as a whole. It you avoid journeys, long journeys, short journeys. That's what you start avoiding, and it has impact on your whole life. What are the psychological effects? Eventually, it causes depression. No social contacts. Because of no social contacts, baseline pain is always there at every step. It spoils the relationship with the relatives because you are always irritable. So these are the physical effects of osteoarthritis. Basically, it gives you the full platter. Diabetes, if it is there, it becomes uncontrolled. Hyperlipidemia increases. Obstructive sleep apnea can increase. Heart disease, if it is there, that because walking is reduced, heart disease also goes under without any control. Hypertension, osteoarthritis, these are the whole platter which it gives because of osteoarthritis. So what are the stages of osteoarthritis? These are different stages of osteoarthritis. On the left hand side, you can see that is the normal knee. Stage one is basically this articular cartilage starts wearing off slightly. Stage two, it wears off more. You can start seeing osteophytes. You can start seeing some gaps under the articular cartilage. In advanced stage, stage three, basically the bones start coming together, and in stage four, as you can see, the gap between the two bones is totally gone. So, but what you don't see in between the two bones is the articular cartilage. So, if the cartilage starts going, the gap between the two bones starts disappearing. So the investigations, what investigations we do? We do the X-rays, MRI scan. If the symptoms don't match with the X-ray pictures, sometimes we ask for MRI scans. Scanogram is basically to see the alignment of the hip, knee, and the ankle, and how much correction is needed. That is what we see with the help of scanograms. So this is the X-ray of the normal knee. As you can see, articular cartilage is almost normal. The gap between the two bones is well maintained. The alignment of the knee is also normal. So if you see this, basically the gap starts basically reducing gradually. The knee starts going into varus. So you start bowing of the both the knees. That's what starts. What is the treatment for these two stages? Basically, the medicines, glucosamine hydrochloride or glucosamine sulfate. There are other nutrition supplements, nutraceutics available like diasterin or chondroitin sulfates. These are the medicines which basically prevent the cartilage degeneration. The other treatments are basically lifestyle modifications. You stop sitting cross-legged, stop going up and down the stairs. If you sit for a long time, keep the knee straight. Regular exercises, stretching, strengthening exercises, medicines, as I already told you, nutraceutics, use of cane, which is sometimes quite embarrassing for senior citizens, but that helps quite a lot in reducing the pain of osteoarthritis. Splints, OA knee braces, the picture on the right side, as you can see, these basically are sort of offloaders. So whichever side of the knee you get more pain, these offloaders basically shift the weight bearing on the other side so that the pain is reduced. So as you can see, this is stage 3 osteoarthritis. The gap has further reduced on both sides, and the pain is quite severe in this particular stage. So you start doing these exercises in addition to the other treatments which I told you earlier. And what else? What you can do at this stage is you can give viscosupplementation, which is like a lubricant fluid which can be injected inside the knee joint, which helps in lubrication. It also actually resists the compressive forces. So it prevents the articular cartilage to some extent. So Synvisc 1 is one of the viscosupplementation. It is again a non-vegetarian source. Sometimes people want vegetarian things only. So this is derived, it's a non-vegetarian, it's derived from chick embryos. Similar properties, this has similar properties as normal synovial fluid, and it can be given along with the steroid injection also. So this is stage 4. As you can see, the articular cartilage is totally gone. The gap between the two bones has totally disappeared on both sides. It's bow legs. The shape of the bones, as you can see, it is curved inside. And basically, this is severe osteoarthritis stage 4. This again is the example of severe osteoarthritis with bow legs. Another example, as you can see on both sides of the joints, the gap is reduced. So this is most probably rheumatoid arthritis, because rheumatoid arthritis affects the joint as a whole. So it affects both sides of the joint. Osteoarthritis affects only one side of the joint most of the times. So what is done for this? This is the knee replacement. The worn cartilage is taken off and it is replaced with a cap at the top, metal plate at the bottom, and in between is the plastic. So the movements occur between the joints like normal joint. So this is patellofemoral arthritis. Under the kneecap, when you get the arthritis, you get severe pain while getting up from the chair. You can get pain while going upstairs. So basically, the load on this joint is almost 3 times your body weight. So if you are getting pain and if you reduce your weight by about 10 kilos, the load on this joint reduces by about 30 kilos. So that is the effect of weight on these particular joints while going up and down the stairs. So unicompartmental arthritis, these are mainly unicompartmental arthritis, and a treatment for these particular arthritis can be replacement of only one part of the joint, like patellofemoral arthritis. If it is there, you can replace only patellofemoral area. If it is medial compartment arthritis, that is inside of the knee, you replace only the medial compartment, which is called as unicompartmental knee replacement. So this is the example of unicompartmental knee replacement, where only one part of the joint is replaced, the rest of the joint remains normal. So this most of the times feels like a normal joint, and but the disadvantage is it is not guaranteed that it will last long. And number two, the indications for this are very narrow. What are the advances in total knee replacement? Is basically the advances are mainly related to taking the cuts. Previously, we used to take cuts, all these cuts with the help of jigs. Now we can do it with the help of computer navigation, where different points are registered on the computer. Different points on the knee are registered on the computer. Computer tells you this is where you have to take the cut, and we match that cut. What is robotic knee replacement? Basically, in robotic knee replacement, computer navigation is done first. The planning is done with computer navigation, and robotic arm or the burr takes the saw in the plane of the cut. So that is the advantage of robotic knee replacement. Patient-specific instrumentation is another method where the CT scan of whole leg is done. That is sent to the lab, and from the lab the instruments come for your knee, and those are kept on your knee and the cuts are taken. So these are different methods for taking cuts. So advancements are basically for taking cuts which are with precision. So that is the computer navigation. As I told you, the different points are registered on the bone, and the computer creates a picture. Computer tells you where to take the cut, and that's where we take the cut. So that's the navigation part of it, and that's the robotic part of it. The planning is done in navigation part of it, and in the robotic part, basically this is the saw which is taken. This information is fed to the robot, and the robotic saw takes the saw in the plane of the cut. That's how the robot functions. So this is again the robotic. That's the navigation, and this is the robot part of it. Okay. These are few of the examples. So basically, that's before the operation. That is 2 to 3 days after the operation. And this is again at 4 weeks. Okay, so that's at 4 weeks. This is how the results are. So this is again another example. This is before the operation. This is 2-3 in between is the area with 2-3 days after the operation, and that is the function now. So your walk improves. Basically, the energy consumed is reduced for the walking, and basically you are able to walk much more better and much more than before. So can osteoarthritis happen in the hip? Yes, it can happen in the hip also, because of the steroids or because of alcoholism, because of COVID, many other reasons for hip osteoarthritis. It can lead to avascular necrosis and osteoarthritis of the hip, and that is how the articular cartilage or the hip also can get worn. Basically, it is mainly the disease of Western world. In Caucasians, this occurs more commonly. So in our country, it is mainly because of the avascular necrosis of the femoral head. That means the blood supply to the femoral head gets cut off, and that eventually can lead to osteoarthritis of the hip. Uh, so that is right side is the osteoarthritic hip. Basically, the treatment for this, if it is too severe, then we replace it with total hip replacement. And there are different components of total hip replacement. We don't need to go into the details of that, but this again can be done with the help of a robot. So that is total hip replacement. Thank you. So I was told that we have to have more time for questions. So I think we'll stop there and we'll take more questions now.
Thank you very much, Doctor. Thank you
Thank you.
very much for a very amazing presentation and detailed presentation. So we have a lot of people who have asked questions.
Yes.
I'm going to. So this is a question from Mr. Apurva Mehta.
Huh.
He's 81 years old. He's
Uh-huh.
diabetic male.
Huh.
His left knee cartilage is worn out.
Uh-huh.
And otherwise fit and fine. He stays on the third floor in an old building without an elevator.
Uh-huh.
Is it possible to avoid knee replacement or knee surfacing surgery with regular swimming and medicine like Eriflex or any other supplements?
Basically, I always tell my patients that this is the surgery of the knee, but this is not for the knee. It is a lifestyle surgery. It is for you so that you are able to walk more, and that is the exercise for your heart. If the person is staying on the third floor without a lift, obviously it is difficult for him to go up and down the stairs. So eventually the activity level is going to go down, and that is what is going to affect his overall health. So basically, if overall health is getting affected, it is best to get it replaced. But ideal solution for this would be to shift the house, which is not an easy option. But that is the most important thing, because eventually you will get restricted to that house only, and you will avoid going downstairs or upstairs for the exercise. If you have the option of going up in the balcony and exercise there, yes, you can avoid it. If you are doing regular swimming, that is a cardio exercise, and that is good enough for your heart, so you can avoid surgery. But that is what you have to maintain all the time. You can avoid it, but if it is coming in the way of your lifestyle, you have to go for it.
Right. Thank you. There is a question from Sushma Agarwal who asks, मेरे दोनों कंधों में दर्द रहता है, क्या करूं?
दोनों कंधों में दर्द होता है. Now, as I told you, it is a synovial joint. Even shoulder is a synovial joint, and that also can become osteoarthritic. After the either rotator cuff injury, that is a muscle tears, it can become arthritic, or it can become arthritic because of avascular necrosis of the humeral head. Also, if it is too painful, if it is difficult to sleep on the sides, it is less disabling than, I would say, knee osteoarthritis or hip osteoarthritis, because it is upper limb. Your walking doesn't depend on that. You are still mobile, but few of the activities can become difficult, like going overhead, getting the dabbas from the top shelf. All those things will become difficult. So in that particular situation, that is completely your choice, because it is again a lifestyle surgery. It totally depends on you whether you want to go for surgery or not.
Right. Thank you. We have a question from Sunita Verma. It says, can osteoarthritis cause the foot bending?
Foot
Bending.
Foot bending, yes, because osteoarthritis again, eventually the bowing starts of the knees. Most of the times it is inward bowing of the knees, and that affects the whole lower limb. Hip get affected, spine gets affected, the way you walk it gets affected, and eventually the ankles also can get affected. So it affects the whole lower limb. It doesn't affect only the knees. It affects the joints above, joints below also.
And this is another question by her. For how long can visco supplementation work? Can we have this again and again?
Basically, if it is grade 2 or 3 osteoarthritis, usually it lasts for about a year. But if it is grade 4 osteoarthritis, it may not last for a few months also. So viscosupplementation works. Basically, it is just a mechanical thing. It is a lubricant, and it basically resists the compressive forces. So long as it is able to do that, it will work for a few months to a year, but after that it will stop working.
Right. This is a question from Rani Shekhar, who says that she has pain in the elbows, the bones of the elbows, of both of them, and even in the muscles, she has pain, and she does regular yoga. Is that something that she should do?
Basically, elbow pain, if it is both elbow pains, then it has to be a generalized disease-like rheumatoid arthritis, or it can be a muscular pain also. It can be tennis elbow on both sides. If it is highly unlikely it is joint pain, unless it is rheumatoid arthritis. Most of the times it is tennis elbow or the muscular pain which is there. So we have to find the cause and treat it accordingly.
Right. We have a question which has come in, which is osteoarthritis hereditary?
To some extent, it is hereditary, but most of the times it is because of the way you use your joint. It is always said that genetics loads the gun, and it's lifestyle which actually pulls the trigger. So most of the times it is the lifestyle which causes these things.
Interesting. Genetics loads the gun, but lifestyle triggers is a trigger. We have a question from Mr. Akhori Mrityunjay Kumar, who says um, in the inflammation in the heel and hip while sitting on MRI done 2 years back found L4, L5 problem because of degeneration. While walking up, no problem. While walking, there's no problem. Is there any solution?
Question quite well, but I gather that it is a problem in the spine as well as in the hip. If it is osteoarthritis in the spine, it is purely mechanical. Usually there are no red flag signs. That means there is no nerve compression as such because of osteoarthritis of the facet joints. I can just show you the model of facet joints. Basically, these are the facet joints at the back of the spine. So these can get arthritic, and that can cause pain. This is purely mechanical pain and can be controlled only with medicines or the exercises. If not with steroid injections, it can be controlled. If it is a hip inflammation, then basically you have to see what stage of the osteoarthritis it is and treat it accordingly.
Right. We have a question from Sahita Agarwal. How long can the knee replacement work? Can it be done again when it does not work or causes trouble?
Basically, by and large, the modern knee replacements work for almost 20-25 years or so, because there are modern polyethylenes which hardly wear, and they can last for 20-25 years or so. If that gets worn or if something happens to it, yes, revision surgery can be done. There are revision processes available, and even after revision, people are able to carry on their activities quite well. If it is hip replacements last much longer. They can last up to 35 years or so.
Right, thank you. We have a question from Veena Khurana, who says she had a knee surgery 2.5 months back, but she still has a lot of pain and problem in walking as well. What should she do?
Right. Basically, the knee pain after knee surgery is not impossible because we replace the articular cartilage. Rest of the structures are still there. The capsule of the knee joint, the ligaments of the knee joint are still there. So the pain can come from the nerves, pain can come from the capsule, pain can come from the ligaments. Okay, so these get stretched over the period. If it is 2.5 months, it is still early period, I would say. If you wait for a few more months, the pain will go. And main purpose again of the knee replacement is not take away the pain of the arthritis completely, but you are able to walk much more. So that is the main purpose of knee replacement. You have to keep it in mind that pain may not go away 100%. It will go up to 90%, 95%, but may not go 100%. But you will be able to walk much more after knee replacement.
In fact, she said that she has pain while sitting and standing.
While sitting and standing, 2.5 months is still early period, I would say. Give it some more time, the pain will go. Will be much better than what it is now.
Okay. This is a question from Bomi, who says, Doctor, how long should we take Uprise 60K tablets, or should we give it a break?
Lifelong. Vitamin D is like having your dinner or lunch. Basically, you have to supplement yourself with vitamin D because we are living in closed environments. We don't have sunlight falling on our body. So vitamin D you have to take every month. I prescribe 60,000 units of vitamin D every month for lifetime.
Right. Thank you. This is a question from Mr. Suresh Agarwal, who's asked, I have pain in both legs in the night. What should he do?
Restless leg syndrome, basically what he is talking about. Most of the times it because the acids get accumulated in the legs throughout while walking and standing. So basically you have to give rest to the legs. You have to elevate the legs, do hydration. If he is not drinking more water, he has to drink more water so that the acids get washed out. Uric acid, other acids which get accumulated, they accumulate mainly in the legs. So that's why the legs become restless. So you have to keep the legs elevated on two pillows and drink a lot of water throughout the day.
Right. So yeah, that's a question which Sushma Agarwal also says. सोते समय मेरे दोनों कंधों में बहुत ज्यादा दर्द हो
That
जाता
is
है,
because
बिल्कुल
most of the
नहीं
time because of osteoarthritis. If you are lying on one side, if you are getting pain in the shoulders, that is because of osteoarthritis of the shoulder. So best way to tackle this is take two pillows or slightly more pillow than this distance, so that basically the shoulder is offloaded. So there is less pressure on the shoulder. So the shoulder pain becomes less. I won't say it will go away completely, but it will become less.
This is a question from Manju Dua. I have scoliosis for 2 years. Can it be cured?
What is scoliosis? Sorry.
SCIOCLOSIS.
Scoliosis. If it is
Scoliosis.
scoliosis,
Yeah.
it is if it is only since 2 years, I would say it is scoliotic list. It is not a structural scoliosis. So it is a curvature of the spine because of the way you walk or stand. That is what happens. It is completely correctable if the cause of scoliotic list is corrected. So most of the times it is caused in the lower limbs and either in the hips or the knees or the ankles. So that has to get corrected. Once that is corrected, the scoliotic list also gets corrected.
Right. Thank you. Doctor, there's a few questions on exercising that has been asked. One is, are strength exercises advised for osteoarthritis? And there was another question which says, is how do you prevent osteoarthritis from happening uh, for
Uh,
somebody who's not has it right now?
So the best way to prevent osteoarthritis is basically avoid few of the activities like sitting cross-legged, avoid going up and down the stairs as far as possible, avoid low chairs, low stools, which cause excess pressure on the knee joints, basically. So these are the few of the activities which have to be avoided, especially sitting cross-legged. That has to be avoided. So
So,
the Padmasana, Vajrasana, sitting cross-legged, these are the activities to be avoided.
so yoga, Padmasana, as you said, is to be avoided altogether.
It is not good in the long run. It is not good in the long run. Initially, when you are young, it is okay, but once you have crossed about 55, 60, then basically the degeneration starts in the knee joint, and once you start sitting cross-legged, you start stretching too much, then the menisci, the cushion between the two bones, that starts tearing. So once that starts tearing, the bones start coming into contact with each other, and that's what basically initiates the process of osteoarthritis. So avoid as far as possible. I won't say avoid altogether, but avoid as far as possible.
Doctor, there's one question which has come in about taking massages and alternative therapies like acupuncture, etc. Are these advisable? Can they cure ailments?
This doesn't cure anything. Massage is like an exercise for the muscles. So basically, it is passive exercise for your muscles. So those muscles which are massaged, they basically the lactic acid is washed out from those muscles, and you start feeling better. But that doesn't necessarily mean that it has any effect on the joints. It has effect on the muscles. So you feel better. Yes, the lactic acid gets washed out from the muscles, but doesn't have any effect on the joint.
And what about things like acupuncture, acupressure?
Acupuncture and acupressure, these are the things which work on the theory which is called as gate theory. of pain control. So basically, the basis behind these theories is if you stimulate the superficial pain. So if you start pinching your muscle, you start pinching your skin, the pain deep inside the joint will reduce. That is the signal which is sent from the skin to the brain, and from the brain the signal is sent to the again to the joint. Basically, the deep pain gets suppressed if superficial pain starts getting stimulated. So that's the purpose behind putting those all tiger balms and all those balms. They are irritants. So they irritate the skin. So the pain in the skin increases. So the deep pain reduces.
And in fact, as I was asking you this question, what about chiropractic?
Chiropractic maneuvers.
Yeah.
Basically, chiropractic maneuvers are mobilized for mobilizing the joint. They are the extreme form of physiotherapy and done acutely, I would say. So these are very good for few things. Few things like, for example, cervical spine problems or SI joint, sacroiliac joint problems. These are very good. Chiropractic maneuvers, if there is slight dislocation, slight misalignment, that gets corrected with chiropractic maneuvers. Yes, it can get corrected. But for knee joint, if suddenly if somebody starts bending your knee joint beyond your pain control, then obviously it is not good for the knee. So for few things it is very good, but it has limitations. So you have to see to it that it doesn't cause pain after going through the chiropractic maneuvers.
Doctor, two last questions. One is from Shilpi Bishwas, who asks, is it advisable to take calcium on a regular basis in the long
Yes,
run?
like vitamin D, lifelong. Yes, there is a requirement of calcium lifelong. 1000 milligrams per day is the requirement after you cross 60. Yes.
And this is a question from Anandaji. He or she has not mentioned what is the location where the person is located, but saying there are many pain management centers at our place. How far are they helpful?
How far are they?
Helpful.
Pain for pain control. If you are able to walk better after pain control, then that is your purpose is served. If the pain is not getting controlled and if you are not able to walk more, the purpose is not served. So ultimate purpose is to walk more, have cardiac exercise.
Doctor, I'm going to ask you a question. You
Yes.
have a very busy schedule yourself, and your number of years of experience indicate that you are, near seniorhood, or if not a senior already.
Yes.
How do you ensure that you ward off, all these threats of osteoarthritis and various pains and aches?
I have osteoarthritis in few of the joints, more or less. In few joints it is more, few joints it is less. But basically, in the baseline, at the back of my mind, I know what is right for me or what is wrong for me. For example, basically, I started online yoga about a year ago, and after 1 or 2 months, I realized that Padmasana is started causing pain in my knee joints. So I stopped Padmasana altogether. So whatever postures he used to tell us in sitting position in Padmasana or Sukhasana, I completely started avoiding those. I started sitting on the chair and started doing those. I know that I can do Padmasana, I can do Sukhasana, but I started avoiding because I know that this is going to cause damage. So after doing certain activities, it is causing pain, then you have to stop those things and not push yourself forward. Basically, there is tendency after the age of 50, 55 or so, you feel that I'm still young, I can still do that. But you have to avoid, you have to control yourself, and you have to listen to your body. You have to listen to what your body says and stop those things because it is going to cause damage, and that damage can be irreversible. So basically, just listen to your body and take the actions accordingly.
Great, doctor. Thank you very much. Listen to your body is, I think, the key message. Thank you very much for answering, responding to so many questions, and you have a very detailed presentation as well. Thank you very much, and thank you very much to the team at the Kokilaben Hospital to facilitate this. And we will be back once again
Sure.
with another session of Health Live at Seniors Today next
Sure.
Saturday. Do remember tomorrow, which is July 13th, we have the finale of season 18 of,
Okay.
uh,
Okay.
of Seniors Have Talent. Doctor, this is a special program where there
Hmm.
are only people above 60 who
Right.
participate. And I must tell you that we can actually have an entire show of only doctors, because we
Right.
have so many doctors who are participating from across the country.
Mhm.
So we must actually think of having a special session for only doctors.
Right. So after 2 years, I can join.
Of course, you must. And there are a lot of good doctors who sing very well, you know,
Right.
around the city of Mumbai and elsewhere. So, so we have that. And do remember that on the 15th of this month, we have the anniversary issue, the 6th anniversary issue of Seniors Today, which is going to be published. As always, this is free of cost and no conditions apply. So you can go to the Seniors Today website and access it. Thank you very much again, Dr. Avinash Date, for being here.
Thank
And
you.
to all of you, enjoy yourself. Have a great weekend. Bye-bye.
Thank you. Thanks a lot. Bye-bye.